So let's see if we have a little bit better understanding after what we've done today. Let's name 2 coexisting conditions that indicate the need for additional professional assessment and or services, and identify which core function this would apply. So, coexisting conditions that indicate the need for additional professional assessment. So we're a drug and alcohol treatment program. A person comes into us, they definitely present with a drug and alcohol problem, but they may have a coexisting mental health issue, bipolar, schizophrenia, or they may have some physical hindrances, okay? They may not be fully ambulatory. Have you ever had somebody walk into the screening room and have a full cast on their arm, cast on their leg? So we're going to need some additional consultation for that, right? And then what core function would that be in where we're gathering that information? Excellent. And in which core function is it necessary to obtain appropriately signed consents? That's right. That's right. Which core function asks that you explain the results of the assessment to the client in an understandable manner? Perfect. But you're also going to explain the results too when you do the assessment. Okay? So it can be both assessment and treatment planning. But in both of those core functions, we want to make sure that the client is a partner with us in this process. In which core function do we explain the rationale of case management activities to the client? Case management. Yeah, and why? I think it tells us. Because we explain the rationale to for the referral to the client to match client needs and programs to appropriate resources. And in which core function is it necessary to elicit solutions and decisions? Counseling. Or client education. Which core function asks you to adhere to applicable laws, regulations, and agency policies governing procedures related to the protection of the client's confidentiality?
Referral, screening,
okay, screening, referral, okay, and why?
Because the release of information will protect us regarding confidentiality.
Right.
And the rights, client rights.
Client rights, empowering them with the right. In which core function would you describe to the client your program rules and their obligations and rights?
Orientation.
How many of you have written a case presentation? So a couple of you? Okay. And so for those of you who haven't written a case presentation, I think, I'm trying to think of which book has an example of that. It's certainly an exercise that you might want to, you know, for a recommendation for continued learning. I would recommend that you write a case out. And it takes a few hours, and it is an investment of time. But learning how to write out a whole treatment episode, it's like if you've ever written a story, you remember that story better than any other story. Why? Because you wrote about it. Those of you who will go on to get other certifications that may require oral exams, you're going to want to have that case presentation as part of the submission for your documents to sit for that exam. once again, that particular case can be a focus on each of the 12 core functions and how you worked with that individual in that core function, touching on each one of the global criteria. It usually takes up anywhere from 5 to 10 pages. I've seen some cases get a lot longer, but certainly is a document that's worth creating for yourself. Maybe if you know somebody that has created one, I'd recommend reading it. And then today, you know, as we finish, using this information, you know, understanding the different components of treatment and how they interact with one another, how you interact with other treatment professionals on your job, how you utilize the information, and most importantly, how this information relates to you being able to provide quality care. Because if there was one reason why I came here today to share this information with you, was the hope that you learned something to make what you did with your clients more impactful.